Everybody knows somebody suffering from cancer and from the collateral damage of cancer-related treatment. So, what if we could replace the standard of care, chemotherapy, radiation, even potentially surgery, with non-toxic options that are based on research, sound evidence? We're going to learn about all of this today. This is a podcast of hope. So, welcome to Vitality Made Simple. This is the podcast that exists solely to help you feel better, look better, and to enjoy better relationships. Dr. Thomas Seyfried is generously sharing his time with us today, and this is mind-blowing information. Welcome, Dr. Seyfried.
Oh, thank you very much, Debbie. It's nice to be here today.
It's a thrill to have you here. Dr. Seyfried, PhD, is a biochemical geneticist. He's a scientist, and he's a professor at Boston College. So you know it's really a shock for him to talk to somebody from Oklahoma. Well, I'll try to translate and, talk a little more clearly. So as you're going to see for yourself, Dr. Seyfried is one of the bravest and most fearless people on the planet because he's challenging the current paradigm in cancer. So, through extensive research, he's found evidence that supports the idea that cancer is actually a metabolic disease rather than a genetic disease. Now, this is groundbreaking, and it really expands our options. So Dr. Seyfried, just start telling us, everything, what sparked your curiosity. Just hit it.
Well, thanks, Debbie. We've been doing this cancer metabolism studies now for 20 some odd years. And before that, we were looking at epilepsy, did a lot of work in the field of epilepsy using ketogenic diets and a variety of gene mapping strategies and things like this. And then even before that, I was looking at cancer as purely a biochemical problem. And when you have diet therapies for one type of disorder in a lab where we have animal models for cancer, sometimes the paths overlap. And we started to look at metabolic approaches similar to what we were using for children with epilepsy into now folks with cancer. And there was a paper in 1995 written by Linda Nebling from Case Western Reserve when she was a nursing student, where she took two little kids. The first ketogenic diet therapy for children with brain tumor was done by Linda at Case Western Reserve. And that's where we saw, because we were doing ketogenic diets, calorie restriction for epilepsy, and we were doing a lot of biochemistry on cancer. But then when we saw this, we said, well, why don't we try restricted ketogenic diets on our preclinical tumor systems? And that's when we found tremendous therapeutic benefit. And then we said, well, how come nobody has ever seen something like this? And they have. And it was Otto Warburg from the 1920s, the giant in the field of cancer biochemistry, who had already described why lowering glucose should be very effective against managing cancer. And we knew from our biochemistry work that cancer cells can't metabolize ketone bodies. They have a bad mitochondria. It doesn't work well. So the solution to the cancer problem became immediately clear to us. And that is, these guys are locked into a fermentation metabolism, which means energy without oxygen. And that's one of the most distinguishing characteristics between cancer cells and normal cells. Cancer cells can live without oxygen. They don't need oxygen. So that means they ferment. That means they use fuels that don't require oxygen. And the only two major fuels is the sugar glucose and the amino acid glutamine. So when we started targeting glucose and glutamine while the preclinical systems were under nutritional ketosis, we were getting remarkable results without toxicity. And then we try on people. And of course, people respond much, much better than the mouse does, because the basal metabolic rate of humans, you can do so much more with humans. The problem at the beginning was, at least for brain cancer, we had to do the standard of care. Everybody had to do the standard of care. And then once you realize the standard of care doesn't work for over 97% of people, then you're okay. Oh, then you might want to try metabolic therapy. So what we were finding was the folks that were getting the powerful radiation to the brain, and then we were putting them on metabolic therapy. They did well. They felt good, but then they eventually passed. And it wasn't clear at the beginning until we realized that when you irradiate somebody's brain, you free up massive amounts of glucose and glutamine, the two fuels that drive the fermentation metabolism of the tumor. So it became very, very clear to us, even though we were doing metabolic therapy, and even though some people were really responding well, we're not getting the kind of response that we were hoping to get. And then Pablo Kelly came along, a young man, was 25 years old, and he said, I want to do metabolic therapy without radiation and chemo. And Pablo's still alive now, 9 years later. So, and everybody, well, it's an N of one, it's only one guy. I can tell you right now, you're going to get a lot more would survive longer if you don't get your brain irradiated for glioblastoma. And then, one thing goes to another. Now you can't, the problem is there's all these oncology centers demand you have to do radiation. It's like a requirement. And I'm telling these poor folks, you're walking the gangplank here. You're going to die if you go and do this. I'm not saying everybody does. In fact, a lot, but I think your outcome would be much, much better if you did the way structured metabolic therapy. And then you can always go do radiation if you want. But if your tumor doesn't regrow and there's no evidence that it grows, why would you want to do radiation?
Well, and with the Pablo story, I read that in your book. And then I saw him on a podcast a few months ago. He didn't go through all that conventional treatment to get himself so worn down initially. I mean, but what was so interesting, Dr. Seyfried, is he was sort of pushed into treatment. He gets diagnosed, and all of a sudden they're marketing him for radiation, and he's like, had a beard, and he was like, whoa.
Yeah, right.
I'm not going to shave my beard. Let me think about this. Which people get so scared, and they don't step back and take a breath and say, well, what are my options?
Yeah, well, listen, when you or anyone in the family is diagnosed with glioblastoma, it's like a sledgehammer hits you and you're stunned, and everybody in the family is stunned. And the first thing you do is you say, what is this? And you look it up on Google or whatever, and you say it's a death sentence. And for the majority of people, it is. But the issue is, we're saying it does not have to be a death sentence. If you do metabolic therapy the right way, I'm not saying we can cure you. The idea is, can metabolic therapy allow you to survive on the planet for a longer period of time without toxicity? And the answer is, I think definitely so. Does that mean you'll be cured? We have no clue. All we know is Pablo's still alive at 9 years. Will he die in 15 years from the tumor he had? We'd say, well, then you didn't cure him. Well, he's lived, he's had a family, he's had 2 kids. I mean, he certainly got on with his life to a high quality, and not perfect. He has some seizures from the surgical radiation, from the surgery, not the radiation. Of course, he had no radiation. He had no chemo. He pushed surgery off for 3 years, which is interesting. So, because we could shrink the tumor down. He was also very fortunate to have what we call the IDH1 mutation, which is, I call it a gift from God. It's a mutation that acts as a drug that restricts fermentation metabolism. So it's a gene mutation that acts like a drug that targets glucose and glutamine. Can you believe this? So, and those guys normally live, here's the interesting thing. If people with those kinds of tumors are shown to have that mutation, by and large, they will already live twice as long as someone who doesn't have the mutation. The problem, of course, is they still irradiate and do all this toxic stuff to those folks, taking away the survival advantage that the mutation has given them. So if you didn't do that's what Pablo, no radiation, no chemo, now he's out 9 years. So people say, well, he's only an N of 1. But man, I wouldn't you like to know if we can get a lot more like that? But for some reason, so when the patients go to the clinics, they're just so devastated. And every major medical school in the country, around the world, all drags you into the radiation thing. England, Germany, Japan, China, United States. they all do the same thing. They grab you and, oh, we got to cut it out right away, and we got to start irradiating you and doing all this crazy stuff. And the answer is take a couple of breaths. Sometimes, every now and then, you need to have an immediate surgical resection for fear of herniation of the brain, but that doesn't happen as it's not that common. So you actually have a chance to shrink that tumor down for 3 weeks before the surgeon could take it out.
Mm-hmm.
And then when the surgeon takes it out, I've discussed it with my neurosurgeon colleagues. The tumor looks different. It looks like it's more indolent already from the metabolic approach. So there's hundreds of papers written in the scientific field showing that if the surgeon can debulk a greater portion of the tumor, the patient already has a great survival advantage. So why wouldn't you want to use a therapy to shrink the tumor down real small or much smaller, and then have the surgeon take it out, and then transition to metabolic therapy and avoid this radiation and chemo altogether? But when you speak like I just spoke, and you go to MD Anderson and Sloan Kettering and all these places, they get very upset and they say, well, this is not what we do. Yeah, but we're trying to keep people alive, not kill them. They say, well, they're not trying to kill anybody either, but they don't know that the very therapies they are using put that patient at a significant disadvantage for survival, because they don't understand the biology and biochemistry of what actually is going on in the tumor microenvironment like we do. So, it's just knowing stuff. This is not this is like some great discovery. It's just knowing stuff. It's knowing about the biology and the biochemistry of the very disorder that you have. Systems physiology, biology, and biochemistry. And we have looked at all this stuff in great detail. And then when you say, what are you guys doing? Well, you should never be doing the stuff that you're doing to these folks. And the outcomes are very, very poor. And we think if they knew what to do and how to do it, things would change for the better for the majority of people.
Well, yes. And, as you say in your book, cancer cells ferment, and normal, optimally functioning cells, the mitochondria, they use oxygen. These cells use oxygen to create energy. So since the current paradigm is seeing this as a genetic disease, the current paradigm, and what I was taught 40 years ago in dental school, is that it's a genetic disease. So therefore you didn't do anything to cause it. You can't do anything to get rid of it. And then, everything even I still hear, Dr. Seyfried, is while people are going through this chemo, it's like, eat everything you can, eat all the sugar you can, just eat, drink Cokes, and so they're operating on that same paradigm, correct? Expound on that. Your book does it so beautifully that we haven't changed how we're attacking, this war on cancer that started 50 years ago. Everything's just increasing.
Yeah, well, you're right, because the National Cancer Institute, NCI, has on their website that cancer is a genetic disease. And the federal government is dishing out hundreds of millions of dollars to the cancer grants, hunting for genes and doing deep sequencing of mutations and building immunotherapies to attack cells to make them. I mean, all of that is based on a flawed theory of what the disease is. But the problem is the momentum that has built up by both the academic and pharmaceutical industries around the view of this disorder being a genetic disease. It's almost like a tsunami. It's such a powerful momentum, and you tell and the hard science says it's not a genetic disease. The nuclear transfer experiments show that. We're now finding driver genes, which are supposed to be the ones that make your cancer grow faster. We're finding all these driver mutations in normal tissues of our body that never form cancer. There are some cancer cells that have no mutations. So when you have all of these kinds of pieces of information that are not consistent with the theory, then you have to say maybe the theory under which we're treating patients and developing therapies and all this is not correct. And the evidence that we have over 1,600 people a day dying in this country, and it's now starting to replace heart disease throughout the world, and yet we're spending all this money, and people say, well, how come we're not making any progress? And the answer is because the theory is wrong. The theory is not correct. And as long as people think it's a genetic disease, we'll never have any major problem. I mean, every now and then you get some, some spectacular response on one of these immunotherapies, but they don't talk about how many people were killed by the immunotherapies. There's this term called hyper-progressive disease, where the immunotherapy will cause either the cancer cells to die so fast, or the immunotherapy will go after some of your other organs and kill you faster than the cancer. And it's not insignificant. You're talking about 18 to 20% of the people being killed by the therapies.
Wow.
And then why would you want to poison and irradiate somebody to make them healthy in the first place? I mean, you see bald-headed children, people, they have to put a scarf. Why are you bald? Oh, I'm responding to the chemo. Well, the cancer is not in the end of your hair follicle. The cancer is in some organ in your body. Why don't you kill the cancer cells? You don't have to go bald. They don't think that way. As I said, metabolic therapy, as a matter of fact, metabolic therapy makes your hair, you get healthier overall. So why would you want to do anything other than metabolic therapy? The problem is you go and you run to the hospital where the experts are there, the so-called experts. And then when you start to pepper the experts with specific questions, they look like a deer in the headlight. They have no clue. And that tells you right off the bat, I have a specific series of questions. I tell cancer patients, ask this of your oncologist. And if he gives you really accurate and good, stick with that guy. He knows what he's doing. If they look at you and say, no, eat as much cake and ice cream, and no, I never heard of that. You're staring at you're working with the Grim Reaper on some of these things. And yes, I don't want to say all of our standard of care therapies have not been successful. We have millions of cancer survivors in this country and around the world who have survived their cancer by toxic treatments. But many of these folks pay a significant health price for that management. They have neuropsychiatric problems, digestive problems, hormonal problems, bone density problems. They have all kinds of other metabolic ailments that they didn't have, but for the fact they survived toxic treatments to manage their cancer. And this is all, to me, quite unnecessary. And but if you go and talk to the folks, they tell you, well, if it were so important, we'd have clinical trials. I would have heard about this. People would be talking about it. Well, they are talking about it. I published a paper in the Scientific. I mean, they're all open access. You don't have to have a membership to any particular journal. You can read the papers. You can discuss. But it's this wall of resistance. It's a dogmatic view that cancer is a genetic disease, and you can't tell the brain that you've been indoctrinated to believe this. And when somebody says it's not it's not right, I just simply can't believe you. So you run into a lot of systems like this. But eventually, people will come to know it's a metabolic disease that can be managed with metabolic therapies.
Well, people are learning, but when they have that deep-seated belief that it's a genetic therapy, then they think they can do nothing about it except just succumb to whatever they're told to do. And I think people are very shocked, Dr. Seyfried, to think their doctors don't read the journals. I mean, your papers are everywhere. There's research on this everywhere. And I guess we assume our doctors are reading that. But, I've learned they're not.
Well, they're overwhelmed with patients and bureaucracy. They're stuck with a whole bunch of paperwork. They get all these patients are coming in by the hundreds. They don't have time. They're exhausted.
Right.
By the end of the day,
Exhausted.
they go home. They just want to relax. They're not going to sit there and read these high-powered papers. That this is what I do. That's what we do. We run the experiments next door. We're reading these all the most recent papers that come out we're aware of. I have classes where students' job is to cover the most recent papers on cancer metabolism and therapies. So we're on top of this all the time, and we're doing the translational research next door in my lab. And then I have an army of physicians out there that want to try this stuff, and sometimes they're not allowed to try it. They're fearing they're going to lose their job or their license or something like this. So it's a work in progress. You have to have the hard, irrefutable science to support why metabolic therapy is the most logical treatment paradigm. And then you have to have evidence from preclinical. Okay, how did the mouse and normal? And the other thing too is you have to have natural cancers, not these genetically engineered things. Some of these models are like you would never run into this in a billion years. These things are all genetically manipulated. They've got all kinds of new mutations, gene expression profiles. You need it. Like we discovered natural cancer in mice, cancers that arise in the natural way like they do in humans. And those are the ones you want to use. You don't want to be using all this genetic stuff. Not to say, and then they're trying to grow human cells in a mouse's body. And they say, oh, look at this, how wonderful. Humans and mice are separated by 50 million years of evolution. The mouse basal metabolic rate is 7 times faster than the human. So making these, and then some people on NIH studies say, oh, you can't, you've got to use xenograft, which is putting human cells into the body of a mouse. And that means it's going to be important. So you have a whole bunch of models that are not accurate. You got to have accurate models. You have to have, and we have I published a paper on the dog cancer, on mast cell tumor from some woman who had the dog, and we used metabolic therapy to completely resolve that cancer. The dog died from at old age, from heart disease. So we can manage these cancers in dogs and people. The problem is that science is challenged because they don't know about it, but their arguments against it are very superficial. It's like, well, it hasn't been repeated, or I would have known about it if it were really important. These are not scientific arguments. The argument is what part of the metabolic pathway that's disrupted do you not see when we have all the readouts from these pathways? And then they look at it, well, I don't know about that. Maybe, you could be right about, what do you mean you could be right about that? The idea is you see tumors shrinking, animals are getting healthy. We just published a paper in bioarchives, open access, and we have a supplement. It's pediatric high-grade glioma, a model. Pediatric high-grade glioma is the #1 cause of cancer death in little children. They have made zero progress in this field. We put together a cocktail, diet drug cocktail, non-toxic, and we have a supplementary video in that paper. People can look at the video and see the animals that were not given the therapy and the animals that were given the diet drug therapy, and there's a striking difference in quality of the animals, the way they look and the way they appear. I mean, you can see it. And I say, if we ever did that in the clinic today with high-grade pediatric glioma, we'd have an enormous success. But they're not doing it. They're locked into this crazy stuff that they do, the system. And these folks that are working there, they're well-meaning. They don't want to harm little kids. Nobody wants to harm anybody else, but they're all well-meaning, but the system is inflexible. And it's the inflexibility of the system that allows this tragedy to continue. So you have to say, who is running the system? Who's making the decision? Why standard of care is written in granite and is not flexible? When something comes along that works, everybody should be extremely interested in that. But you say, oh, well, this is a diet drug and the drugs are like parasite medications and this kind of stuff. Well, we're telling you how it's working. It's working. It's working. It's just that people don't know about. I don't know if they don't want to know about it. It's kind of hard to predict what's going on.
Well, I was so shocked in your book, folks. He wrote "Cancer as a Metabolic Disease." When this is on YouTube, you'll see this book. It's an amazing book, thick and complete. But you talked about how to get an IRB, to be able to do a study. You have to get an IRB, but to do that, you have to still do standard of care. I mean, that really blew my mind, Dr. Seyfried, that you can't just do what you think works. You have to sort of pollute it with what doesn't work.
No, yeah, you're 100% correct, especially with glioblastoma. You must do standard of care. And when that doesn't work, which is 99% of the time, then maybe you can consider metabolic therapy. Or you can do metabolic therapy combined with the standard of care. But they will never allow the critical group. So we have standard of care with metabolic therapy, but we never are allowed to do metabolic therapy alone. because God forbid, if those guys are much healthier and they live twice as long, everybody's want to do that.
Exactly.
And that disrupts a huge, practice in medicine. And everybody be running around, wondering what they're going to do. But I think, we can probably do some hybrid approaches. But in brain cancer, the worst, the single most debility is the radiation to the brain.
Right.
That's if you continue to do that, the overall survival of not over 95% of the patients is going to be shortened. So you got to stop doing that. Maybe some of the other drugs they use, and surgery for sure is part of the standard of care. But it's when you do it, when you can shrink the tumor first and then do surgery. I have no problem with surgery. Surgery can cure cancer if done the correct way. So we want to leave that in the program. And we can leave some of the other drugs as long as and when you're under nutritional ketosis, you can cut the dosage down of those drugs.
Right.
So there's a lot of manipulations you can do to improve the overall outcome for patients. And they're not going to be as sick. They're going to remain healthier. And that's ultimately what you want, right?
So, right. You want them to feel good enough to enjoy what life they've got left. I mean, so many people.
But the other thing you mentioned, Debbie, which is extremely important, is when you do metabolic therapy, the patient participates very significantly in their healthcare. You would have to adhere to the standards of what is expected with metabolic therapy, but you are part of the treatment program. So you're right. You're not just sitting there and being victimized by all these toxic treatments. You, as metabolic therapy, you're playing an active role. You're the one looking at your blood glucose and ketones. You know that we publish the standards with the glucose ketone index calculator. You can buy it from Amazon, and you can the Keto Mojo. So yeah, I mean, we have thousands of people with diabetes measuring their blood sugar all the time. But if you're a cancer patient, you need to do the same thing, except you have to elevate your ketones at the same time. People call me and they say, oh, I've been doing metabolic therapy and I just can't get my blood glucose down, or I can't get my ketones up. Well, then water only fast, you see what happens. Do water only fasting. That'll kick you into ketosis for the most part. And you can just work on it that way. And you just, and people say, well, I don't want to eat this. I don't want to eat that. Well, we don't really care what you want to, or can you, your GKI will tell you exactly what you should be eating. And then they're going to say, well, gee, it tells me I can't eat anything. Well, you can just eat smaller amounts of it, and you'll keep that thing baseline. And then you hit them with the drugs that work together with the diet. So it's a diet drug cocktail combination. And the cancer cells get hammered. They can't tolerate this kind of a treatment. They up and die because they must ferment. And if you're taking away their very fuels and force feeding them a fuel they can't eat, they can't burn fatty acids and ketones, you're killing these guys. And you're killing it in a natural way. And the rest of your body is getting healthy while you're degrading the tumor. Now, what's wrong with that? Why,
yeah, it's so
what's
beautiful.
What's wrong with that?
It's so empowering, Dr. Seyfried, because for one thing, when people realize what a PET scan is, radioactive sugar that goes straight to the tumor, that's what I always tell them, no sugar. Here's why. But then when they see the numbers on their, Keto Mojo, they're empowered, and that decreases fear, I believe, because, they get all this fear, and fear raises blood sugar, for our listeners. And so if you can decrease fear and do some stress management, what would you recommend people do in the stress management area during all this?
Well, we put that in the Press Pulse paper, stress management. You have massage therapy, music therapy, all kinds of other kinds of therapies that are designed to reduce stress. And you're absolutely right. Stress elevates glucocorticoids, which elevate blood sugar. You don't want blood sugar. You want that sugar to be as low and steady as possible. And so there are a lot of things, but the key is it's a combination. You have the diet, you have the stress, you have all of these things that you're doing to lower sugar, and then you come in with drugs at low dosages, and you gradually hammer away at the tumor. And the way you do this is you look at PET scan, MRI, CAT scan, whatever non-invasive technology you have, you look. Now, the other thing too, in the case of Pablo Kelly, Pablo is not cured. he is 9 year survivor for sure. But when you look at his MRI, he still has a tumor in there. Okay, it's indolent. It didn't go away. And Pablo found out that when he started eating a lot more sugar and stuff like this, the tumor grew faster. So he got off it real quick, and the tumor, it's almost like watching something go up and down just by the diet itself. So, but he knows, he's aware, and he knows he's not cured, but he's lived far, far longer than anyone would have expected. If he had done standard of care, he was only supposed to live 15 or 16 months with standard of care. And now he's out 9 years with metabolic therapy. And well, everybody wants to be, I don't know if everybody's going to be like Pablo, but we're starting to see more folks that are doing pretty well. And it's going to be a reevaluation of what works together. You need that diet to lower the blood sugar and elevate ketones. Makes the whole body healthier. Reduce inflammation. The whole body inflammation goes down. Blood sugar goes down. When you irradiate somebody, whether it's in the brain or some other tissue, it's a monster inflammation inducer. Blood sugar goes up, inflammation goes up. Why are you treating somebody with a therapy that makes an ideal microenvironment for the tumor? It actually facilitates the rescue of the tumor. So all of this stuff makes no sense if you understand the biology and biochemistry of what's going on.
No, it makes no sense. They get swelling as a result of all of that. So they put them on steroids. The steroids raise the blood sugar. You know, it's just this vicious cycle. So Dr. Seyfried, what other types of cancer are you using this press pulse metabolic therapy in?
Well, we're trying to find, and we have not yet found any cancer that can survive without glucose and glutamine. And that's because if I did a very deep study looking at hundreds of papers to see if I could find cancer cells that have a normal number, structure, and function of mitochondria, the energy producing cells, the organelle in the cell. And we can't. Whether it's liver cancer, lung cancer, colon cancer, bladder cancer, breast cancer, all the blood cancers, the leukemias, they all have the same problem. They all have a very similar problem. They're dependent on a fermentation metabolism for survival. That tells us right there, a singular therapy could be effective in managing the majority of cancers. So you don't have to run off and say, oh, you have this special cancer, or we have it. They're all very similar. They can't live without fermentation. And we have not yet found any tumor cell that can live without glucose and glutamine. So it tells us right there what the vulnerability of these cancer cells are, because they all have a similar metabolic problem. They're dependent on fermentation, which is energy without oxygen. So you can take these cancer cells and put them in no oxygen, it's still fine in there, as long as they have fermentable fuels. You can pour cyanide up. Cyanide kills animals real quick, but not a cancer cell. Cancer cells live in cyanide. They can live, you can't kill them with cyanide. What does that say? They're fermenting. They're not using oxygen. So what are they using then? Because without energy, nothing can grow. Everything is energy, ATP. Okay, so where are they getting their energy from? They're not breathing, they're not using oxygen. And the answer is they're fermenting. Now, the big stumbling block in the cancer field from some of the top academic centers is if you take cancer cells and grow them in culture and you measure their oxygen consumption, they're sucking down oxygen. Oh, that means they're breathing. No. We have shown that oxygen consumption in a cancer cell is not used for ATP synthesis. They're using it for other things, reactive oxygen species and these other things. They're not making, when we breathe air, that oxygen is used to make ATP in our system. When cancer cells take in oxygen in the culture dish, they're not using it to make it. If they make ATP from the oxygen consumption, it's very, very small. It's not sufficient to drive the beast. So they have to ferment. And you can take away all the oxygen. As long as they have fermentable fuels, they're going to be okay. So that tells us right there how to manage the disease. That right there, we know how to manage this disease.
So these cancer cells are using sugar. We get rid of that with the diet. They're also using glutamine. Glutamine is a non-essential amino acid, which means, listeners, that non-essential means your body produces it. You don't have to eat it to get enough. But of course, glutamine is in lots of foods too. So how do people manage
glutamine? That's the drug. Those are the drugs that we use, and they have to be done strategically. So you can't just throw in a glutamine inhibitor on top of the body, because then you shut down the value of glutamine for your gut, for your immune system. If you kill a lot of cancer cells, there's dead cells in the location of where you kill them. Okay, well, we got to get rid of the corpses. There has to be a physiological system that moves into the area where the tumor once was. You got all these dead and dying cells in there, and our immune system cleans up the mess. The issue, of course, is the immune cells need that same glutamine as much as the cancer cells use it. So it's the singular molecule that both the normal cells and the tumor cells need. The normal cells don't need glucose because they can burn ketones, so we can eliminate that. But the normal cells need, especially the immune system, needs glutamine. So you have to be strategic. This is, again, why you need to know the biology of the disorder that you're working. If you don't know the biology and also the evolutionary biology, how these cells arrived and doing what they do over time, you can then exploit those differences. So we pulse. That's why you call it press pulse. You can press glucose down hard, but then when the body is in nutritional ketosis, you just hit them with a small dose of glutamine targeting and pull it off. Let the body recover. Wait some time, put it back on again. And then you see how the PET scan, MRI scans start to look. You don't want to pour in a whole bunch of glutamine targeting drugs, not only because you're going to make the patient sick, you're going to make his gut, he's going to have all kinds of gut problems, and his immune system won't work. So you've got to know the biology of the different populations of cells and play one group of cells off of another group of cells. And that's what it means to understand the biology of the problem. Now, you go into a cancer clinic anywhere in this country or around the world and tell them what I just told you, they won't have any clue. Mm-hmm. They don't have any. And how do I know that? Because we've asked these guys, and they just don't know. And that's that they should know. That they need to be retrained, re-educated to know what the biology of the very disease they're working with, so they can get better outcome. They really want their patients to do well. They want to give their patients a therapy and have the guy come back in a year and say, "Doc, I have no clue of cancer in my body. I've never felt healthier." And that's ultimately what we're looking for, long-term outcome of success. And that we can achieve that. No question about it. We can achieve it.
Yes, that's so exciting. I mean, people can die with cancer and not of cancer. Like you said, you can live a long, fun life to 90, and it doesn't matter what you have in your body when you die of old age or naturally. But I think your therapy, your press pulse metabolic therapy, is so empowering. It's decentralized health, Dr. Seyfried. I mean, it's people saying, "Wait a second, I've got a brain, and I'm going to use my brain to help get healthier." But where do people find a doctor who will listen?
Well, that's the biggest stumbling block. And it's such a tragedy for me to hear so many people contacting me, so enthusiastic about doing this metabolic approach, and then go to their clinic and get slapped down saying, "Oh, this is all nonsense, and this doesn't work, and there's no evidence to support this." And so they clearly are not aware of what. So you say, where are we going to go? Well, you certainly right now cannot go to the top medical centers. Maybe for brain cancer, where they have heard that ketogenic diets might have some therapeutic benefit, but and they may be able to work with patients for brain cancer. But again, they're forced into this crazy radiation stuff. But if you go lung cancer, colon cancer, breast cancer, most of those folks have never heard of metabolic therapy, even though we publish all these papers on it, even though we've looked at the biochemistry, or others have looked at the biochemistry. We see the strategy for managing the cancer, but you're right. We have not yet brought this into clinical practice, except in small case reports and a few, which I write up. I've written up a number of these reports. And so I know what to do. We've done one for advanced lung cancer to the brain. He's on a Mediterranean diet, calorie restricted Mediterranean. He's doing fine. He's out 9 years. And another woman who had stage 4 breast cancer also metastasized to brain and bones, and she's doing well. As a matter of fact, Maggie Jones and Brad Jones, who just developed the documentary, the movie, the documentary on the cancer revolution, are now collecting all these so-called terminal cancer patients that have done metabolic therapy and are doing fine. And they all want to tell their story about what they did. So I think that once that documentary comes out, and again, it's the education. If you go, we definitely, and we say, well, clinical trials. Well, who's going to do a clinical trial? Who pays for clinical trials? And usually it's the pharmaceutical companies. They have enough funds to do clinical trial. Well, there's not, so far, I have not yet found a pharmaceutical company that would like to run a big clinical trial on metabolic therapy, because there's nothing, we're not using any toxic drug. We're using repurposed drugs and diets and things like this. And again, who's trained? We need a cadre of trained physicians that know, okay, we ran into this little stumbling block here. How do we overcome that? Or how do we bypass or deal with that? And then we need to work together as a community of knowledgeable people and start training the re-education in the cancer management field. Medical, this is the job of the medical schools. They should be training their oncologists to know how to use metabolic therapy as it by itself or combined with other standard practices. So it can happen, but the biggest motivation to do this is coming from the patients.
Exactly.
It's not coming from the establishment.
Right.
So the system is not accepting this, but the patients want it. And the science is there. It's not like hocus pocus, mumbo jumbo. The science is there. I mean, we have published so many papers. Others have done the same thing. People have to add. They have to take their congressmen, their senators, tell them, I want metabolic therapy. Why is this not a branch of the NIH?
No, they need to read your book. They can at least start with a, Keto Mojo, get their ketones and glucose in line. Are there any natural glutamine inhibitors?
Well, I don't want to say natural. There are drugs
or off
that can,
non-prescription is a better term.
Yeah. Well, the one we use, the embendazole, fenbendazole, like what Joe.
Oh, you do fenbendazole. Okay.
Oh yeah. Well,
fenbendazole as a glutamine inhibitor.
Yes. Well, we're showing that now. Actually, we have some evidence that this might be inhibiting glutamine.
Oh, that is incredible.
Yeah, we're working on it. In fact, we published a paper right now in bioarchives. People can look at it.
Okay.
We used embendazole, not fen. It's a very similar drug.
Yeah. It's really the people form of it. Dr. Seyfried and I talked off camera about a previous interview I did with Joe Tippins. That's been, I get emails every single day asking about that interview, and people are always, wanting just to take this dog dewormer, fenbendazole, that they can get over the counter. But I try to tell them, you've also got to be in ketogenesis. That was a real key for Joe. He couldn't eat. His throat was fried because of his radiation treatment. So he was doing the keto diet because that's all he could do, and really extreme calorie restriction. So that's where you're coming from, and we know it all matters.
Yeah, we published many, many papers on showing how calorie restriction, water-only fasting, and this kind of stuff lowers blood sugar, reduces inflammation, kills the tumor cells, elevates. It's just an overall super health benefit thing. And then you take a little bit of a drug like embendazole, fenbendazole, and you throw it in there on, again, dosage, timing, and scheduling. And the tumor cells now become extremely vulnerable because you've removed their glucose, you've removed the inflammation, you removed all of the acidification in the tumor microenvironment. And now you're coming after their sole surviving metabolite, which is glutamine, and you're blocking the ability of the tumors. They get hammered. The tumor cells up and die, and they get hammered. And not only that, a lot of other things go away, like Guy Tannenbaum, who had advanced prostate cancer, and he did these water-only fasts. And not only did his prostate cancer go away, so did his type 2 diabetes, hypertension, high blood pressure, and he lost like 55 pounds. And he got really, really healthy, and everything went away because all of these chronic diseases are all linked to overabundance of sugar in the blood. So, it's all linked to inflammation, systemic inflammation, and over levels of blood sugar. So it's not complicated. It's the thing. It's not complicated, but it does require self-motivation. You have to be able to motivate. And people say, well, we can prevent cancer. Sure. It's very hard to get cancer if you keep your mitochondria healthy. But the problem is we have an obesity epidemic. And if people were really, really concerned about cancer prevention, we would not have an obesity epidemic.
Amen. Amen. It would not be love your body, even though your body is very unhealthy. I mean, you want to love your body, but you want to love your body enough to get healthy.
Yeah, but it's not easy.
No, it's not easy.
I understand that. I mean, you got delis and fast food stores on every corner. Almost everything we're eating is highly processed carbohydrates. We're not getting the exercise we need. I mean, there's so many things that go into this prevention strategy that we're addicted to glucose. The society is addicted to sugar, and we don't exercise enough, and we're not healthy. And but it all could change. But I don't think people want to change. So, except if they got cancer. Now, if you get cancer, then all of a sudden it's a game changer in your mind because you have this impending doom that you're going to die. Now reality comes back and sits right across the table from you, and you have to then make decisions about what you want to do. But metabolic therapy allows the patient to make choices about how they want to live their life from now on. And those choices can allow them to live a much healthier life and manage their cancer, or go on standard of care and roll the dice and see what happens. So it's, again, these are choices that people will need to make, but at least they should be given those choices. Right now, you go and you're not even offered these choices, and like you said, Debbie, they're told, oh, eat whatever you want, have cookies and cake. I mean, this speaks to a profound lack of knowledge. You shouldn't be saying that. That's like somebody who's trying to get over alcohol addiction and say, go to the bar every night and just sit there and see what other people are drinking. That's not productive. It's not helpful. So you really have to know what's going on.
Well, and if people know that it's not a genetic disease, it's basically a lifestyle disease, a metabolic disease, and that things they're doing in their lifestyle are increasing their chance of cancer. You hear bits of that, Dr. Seyfried, but we really aren't talking about that enough, that it's somewhat in your control. I always joke that people think this cancer bird just pooped on them. They're walking along doing life so well, and boom, they've got cancer. And then they get treatment, and then 3 years later, oh, my cancer's back. And, because they didn't know they could do anything.
Yeah, no, it's really quite sad. It's hard to get cancer. People say, well, you shouldn't say that. It's hard. You really have to abuse your body, something fierce. And then people say, well, I never smoked, I never drank, I never did this. And I still got cancer. Well, you may have been exposed to excessive amounts of carcinogens in the environment without you knowing about it. There's a lot of what we call secondary risk factors that lead to what cancer is called dysregulated cell growth. That's what cancer is. The definition of cancer is dysregulated cell growth, cells in some organ of your body, whether it's a blood, whether it's a colon, whether it's a brain or breast or lung, whatever. You have dysregulated cell growth. Where did that come from? Well, a lot of folks get lung cancer, never smoked at all. But we have a variety of toxins. Every time we breathe air into our body, there's particulate matter. And some people may be more vulnerable to that than other folks. So even the inherited risk factors like BRCA1, Li-Fraumeni, there's a variety of neurofibromatosis. There's certain genes that are put you at risk for developing cancer. They're not causes, they're risk factors. They can only cause the cancer if they damage the ability of the mitochondria to generate energy. Because some people inherit these mutations. Oh, I'm a carrier of BRCA1, but they live their whole life and they never got a cancer. How do you explain that? Because that gene in that person never affected the mitochondrial function. But everyone who has a BRCA mutation and then develops a breast cancer, if you look at the mitochondria, they're dysfunctional and the cells are fermenting. So we know that some of these inherited mutations affect the function of the mitochondria, but it's not 100%. There's no known mutation that's 100% penetrant, meaning that everyone who has that mutation always will develop cancer. And that there's none of that. Leaf-Raumeni is the highest at about 84% or something. So you get, 15, 16% of people have the mutation, they never develop cancer. How's that? So that means it's a secondary risk factor. If you have the only primary cause of cancer is respiratory dysfunction with a coupled fermentation, a compensatory fermentation, just like Warburg said. So we have now cleared up the mystery around, or a lot of the controversy surrounding Otto Warburg's central theory. It was his hypothesis. We've taken his hypothesis, shown where the scientific field made mistakes, misinformation, even Warburg made misinformation, clarify it all, and rebuild it now into the new mitochondrial metabolic theory of cancer, which is the true, once the field knows that, then the strategies for managing cancer are going to accelerate, and the outcomes are going to be remarkably better than they are right now.
So people can work on their blood glucose now. I mean, I'm an advocate that everybody needs to have a glucometer and know where it is, because, if your blood, if it's stable, I mean, you greatly decrease your chances, correct?
Well, yeah, but that's true. But blood glucose is so capricious. A person could look at a dog and think the dog is going to bite them, and the blood sugar goes skyrocketing. So fear, emotional stress and things will make blood sugar. So it kind of goes up and down during the course of a day. You have the dawn effect. When you're sleeping, the first thing you wake up, the blood sugar is elevated because you're getting ready for the day. So the body responds in different ways to blood sugar, and it can be very variable. So that's why we developed the glucose ketone index calculator, because you divide the blood sugar by the level of ketones, and that's where you take a lot of the variability away. Problem is, you've got to be eating foods that have low glycemic index. You have to have foods that are not going to elevate blood sugar, and then you can get into these stable zones for a while. And I'm not saying for a person who has no cancer, they just want to feel healthy for a while, they can go on one of these extended fasts, or foods that keep blood sugar stable and ketones stable, and then you can get into the zone, see how you feel about it. So there's a lot of ways to do this. We built the glucose ketone index as a help for cancer patients, specifically glioblastoma. But now we see all these health gurus that are out there on the web using the GKI just to tell everybody, if you can get your GKI into 2.0 or below, you're going to get super healthy. For no linkage to cancer, just to make your overall body healthier. I have no problem with that. I mean, if this is what they want to do, but I built it for cancer patients specifically.
Well, I got it after listening to you, and I have actually a diagnosis of chronic lymphocytic leukemia. So you said it works for the blood cancers, and just through the various things I've done, I mean, I feel great. My monoclonal B cells are in half. So just simple lifestyle things. I haven't seen an oncologist about this at all. So it works, folks. I mean, I think if you're worried about cancer, buy a Keto Mojo. That's going to just give you a lot of.
If you just want to get healthy, you want to see how, because there's now a lot of people on there comparing their GKI, glucose ketone index values, with each other. And they all have, group meetings and say, "Oh, look at my GKI value today." And I have a friend, Dominic D'Agostino, who is a big into physiology, and he's a weightlifter, and he does all this stuff. So I had a student in my lab, and she water only fasted for four days, and her blood sugar was down about 48 milligrams per deciliter, but her ketones were nice and high, about 5.5 millimolar, and she had a GKI value well below 1. It was like 0.35. So I said to Dominic, look at this. Zenip got a really, oh wow, that's really interesting. So he came back about a week later, and he showed me a blood glucose 25 milligrams per deciliter, and a ketone that was up at about 7. His GKI was like 0.2. And I said, "What did you do?" He said, "Well, I water only fasted for 4 days, and then drank some of he makes this ketone cocktail with it that he made these ketone bodies himself in his lab. And ketone bodies will really push down blood sugars and elevate blood ketone. So he was able to get a GKI, the lowest I have ever seen anybody. But don't forget, people always say, "Oh, your brain needs some glucose." What really you need glucose for is the blood cells. The blood cells must have glucose because they have no mitochondria, so they're dependent completely. But they need such little amount of glucose. They don't need much. So there was a study done by Dr. Drenick years ago where he took morbidly obese people and he fasted them for a month. I think it was a month and a half. Their blood sugar was down and their ketones were up. And then he injected them with a high dose of insulin. Okay. And he pushed the blood sugar down to 0.5 9 milligram per deciliter. Any physician will tell you that that person should be dead when you have a blood sugar that low. They were completely fine. There was no cognitive problems at all because the ketones replaced glucose for the brain. Mm-hmm. So that's a perfect example of how powerful ketones are for the brain. So you're not going to go unconscious. So again, you've got to know physiology and biochemistry and this kind of thing. And the cancer cell under those kinds of conditions are really under tremendous stress and they can't survive in those kinds of conditions. So you throw in a little glutamine inhibitor in there when the body's in ketosis and you're in these kinds, boy, you can kill these tumor cells in all kinds of different ways without toxicity. So it's going to be exciting, I think. Once the field comes to know about this, there's going to be all kinds of new approaches for managing cancer without toxicity.
Well, I know you're a trailblazer in spreading that message. You're so generous with your time, and I can't thank you enough, Dr. Seyfried. Your book is fascinating to my listeners. I'll put this in the show notes, and it'll be on the YouTube. It's a wonderful book. It's empowering. You don't have to be fearful of cancer anymore. There are ways to treat it from a metabolic standpoint that won't wreck your life and wreck your pocketbook either.
The other thing too is we have those papers. Press Pulse was not in that book. That came after, and that's now you can get that in open access. So all you have to do is put my name and just say publications. And a lot of these publications now are free. So you can get them they're all open access. So nobody has to go to the library or anything like this, have a special subscription. They're all out there. It's just people can get them and read them and discuss them and make their own decisions.
Yeah, it's incredible. It's so exciting. Well, Dr. Seyfried, thank you so much. And thank you, listeners, for tuning in. Vitality Made Simple is now in 104 countries and over 3,000 cities. Everybody needs this information. Cancer is a problem worldwide. So share it with your friends and loved ones. And blessings until next time.